make sure when you exercise, drink enough, make sure you're hydrated, and don't get dehydrated. That's really important when you're pregnant. You need more fluid than when you're not pregnant.
How come spinning is more damaging than like running or something?
It's not damaging, but your cardiovascular system in pregnancy can only take a certain amount of exercise. And spinning is probably, I think, I've never done it, so it's probably one of the more extreme ways to do exercise, I believe. And we don't recommend extreme exercise. Now, usually people don't hurt themselves with spinning. There are exercises we don't recommend because you can fall more likely. So those are the other exercises like any kind of contact sports, horseback riding, you should be careful with.
What about exercises, like people ask me a lot about stomach crunches and sit-ups while they're pregnant? You
can do it, but I would say after the first trimester, most women will pretty much know after this.
It doesn't feel good.
It doesn't feel that great. So listen to your own body. First trimester is good. Second and third trimester, listen to your body. And do exercise, swimming, walking, good stuff. You can do weights.
A doctor that I go to, not my OBGYN, but a doctor that I go to, just like she checks up and does my blood work and whatever. She gave an interesting recommendation to me that I had never heard of before. She said that if, like, once I'm at the end and my water breaks, if my water breaks at home, then I should not try to like, deliver naturally. And I'd never heard that before, but she said because, and of course this is coming from the doctor, so I thought, oh, you know, she knows exactly what she's talking about. But she said because if it breaks, the fluid that helped the child get out is gone. And so she said if she could tell me one thing that she recommends that once I go in and if this has happened, then I should get a C-section, which is something I wasn't even considering.
Right. So just because somebody's a doctor doesn't mean that they know what they're telling you. Just because somebody's a lawyer doesn't mean that they're ethical and they know the law and they follow the law. So just because of that, it doesn't mean that you have to believe that everything that they're saying is true. When you break your water, the protection between the baby and your vagina on the outside is broken. And that means that there's an increased risk of infection the longer it takes for you to not be delivered. About half of all women will break their water before they go into labor. So it's not unusual, and most of them will go on and deliver normally. So just breaking your water and having not enough fluid around the baby does not necessarily mean you need a C-section. It does not increase your risk of having a C-section or that there are any other risk factors. What it does mean is that you should go to the hospital and be checked out, because at certain times you think you broke your water, you really didn't break your water. There could be something else. And once you break your water, we look usually as to the timing of the pregnancy. If you break your water close to the due date, the baby should be delivered within a reasonable time period. And the reasonable time period is about 12 to 24 hours. And if the water breaks before 32 weeks, for example, we try to delay the pregnancy because these are very premature babies with complications. And at that point, it's safer to wait a little bit longer. But in terms of cesarean sections, that was your main question, breaking your water first does not increase your risk in and by itself of needing, there's no need to do a cesarean section because of that.
And then there are, of course, people like myself whose water never breaks until they do it for me. So a lot of people have this image, I think it's of movies in Hollywood, of you walking down the street and it's like going to gush out and it's like, oh my god, I have a baby. It doesn't happen to everybody. Everybody's experience is very different. But it absolutely doesn't indicate the C-section.
So there are certain times where we have to break your water for you. That is true.
So painful.
How do you know? How do you know to go? Like to go to the hospital?
Either in my case, first time I went into labor, because you can go into labor without your water breaking. You have contractions and everything else. And second time I was induced. That's Grünebaum.
The number one question, the top of all questions pregnant women have, other than is my baby going to be okay? How do I know I'm in labor? And the answer is actually not as simple as you may think. The simple answer is you pretty much know when you're in labor. First time moms do not deliver at home unintentionally, but it takes time for labor to begin and then eventually to deliver this baby. But what I usually say is when your contractions start, you count contractions, and when they're less than 3 minutes apart, they last more than 30 seconds. And when you start singing your favorite song when the contraction begins, and you have to stop singing it because there's so much pain, that pretty much tells you you're in labor.
And you pretty much know, like, I'll make you all laugh. So after the first time I was in labor, my contractions started and I hadn't broken my water, and they were 5 minutes apart for 1 minute for 1 hour. So I thought in my head, I don't know if I was like extending the amount of time they were going for, I don't know, but I was like 5-1-1, I'm having a baby. And I felt great, and it wasn't that bad, the pain. And I put on mascara and I blow out my hair, and I packed my bag and I was like ready. I was like, Darren, this is going to be awesome, this is going to be so easy. I did Pilates for the last 9 months, it's like a breeze. So we got in the car, we drove up, we lived in Tribeca at the time, so we came all the way up the east side. Justin Timberlake's Sexy Back was playing, and I was like, this is just great. It was like a summer evening, it was so brilliant. I got to the hospital, and I remember getting to the delivery ward, and I saw the nurse. And I was expecting just to, just be scooped up and brought into a room. She looked at me, and she was like, why are you here? And I'm like, because I'm ready to have a baby. And she's like, no, you're not. I'm like, what are you talking about? Like, you're going to check me out. And she's like, you're not ready. So they sent me home, and I was like mortified because I was convinced I was going to give birth at home, and this is a disaster, and I wasn't going to get an epidural. It was the whole thing was going to be a disaster. 5 hours later, I was a heap on the floor of my apartment with like mascara streaming down my face, still 511. My hair was like this horrible bun, and like screaming at my husband to get in the car, and all I remember is the potholes all the way up the avenue, which I didn't remember the first time. And when I got there, it was the same nurse, and she gave me a big hug. And it was just like, you're ready, and you just. No, and the first time, if you think you're there, it doesn't matter if you're not there and you go in and they send you back, like don't be upset or mortified by it. Like you're going to get there soon enough, and then you're going to have a lifetime of raising a baby, so just try and be patient, because it'll happen, and when it happens.
About 1 in 3 women, when they come to the hospital, they think they're in labor, are not in actual labor. Because labor is not just having contractions. Labor is also your cervix changing. So in order for us to know that you are in labor, so we need to do an exam, and we need to make sure that the cervix is changing. And that really tells us. And optimally, when it's your first baby especially, you don't want to be admitted to the hospital, unless there are risk factors, until your cervix is a little bit more dilated. Because hospitals are not the very best places for anybody to be. So you want to keep your stay as short as possible and be only there with good labor.
But if you're dancing to Justin Timberlake, you're not ready. It's pretty much a good way to measure how much it hurts. More questions?
No?
Oh, I had a question about sleeping. I've heard mixed things about sleeping on the left side versus the right side versus your back. So I wanted to ask about that.
There's a question about sleeping, which side you should sleep on. It's so difficult to control your sleep. How do you control your sleep? Do you put pillows on your side? Do you tell if you're sleeping with somebody in the same bed? How do you make sure that they are not in the way when you want to move around? So it's one of the most difficult things. In addition to this, pregnant women have difficulties being asleep. I usually say, get a real advanced Netflix subscription, because you're going to be up at night all the time and you can watch all the movies you always want to see at night because you're up. But the general recommendation is to sleep on your left side, specifically in the 2nd and 3rd trimester. I used to not believe this. I thought there was a lot of incorrect information out there. But more recent research has shown that your pregnancy outcome is slightly better, not much more, if you try to sleep on your left side. Having said that, if you sleep on your back, it's probably okay too. If you sleep on your right side, It's not a big deal. But if you can control it, try to lie down, specifically when you're awake, a little bit on your left side, because it displaces the uterus a little bit more.
Is it due to your kidneys or?
No, it's actually, there's a vein, a big vein, coming up from your body, going to your liver and your heart. And there's a condition called vena cava syndrome. It's a medical condition. If a pregnant woman is, for example, lying directly on her back, specifically with anesthesia, her blood pressure can drop. So that's why we recommend left side or right side. When you have a C-section, for example, for those who have had a C-section, we'll put a pillow on the right side, so shift them a little bit around to make a little bit, to push the uterus off the vein, the big vein.
That's it? No more questions? Well, thanks everybody for coming. Thanks, Dr.
Good.
Grünebaum.
And good luck with getting
Yes.
pregnant and having a baby.
Hope you guys feel a bit more relaxed.